Hello everyone, my name is Dr. Karan Shetty. I'm a plastic surgeon here at Tara Healthcare. We are from Bangalore. Today we're going to be answering some questions sent to us by our listeners from Instagram and YouTube. These are some important questions which we have filtered down from, I think, about 50 to 60 questions that we got, and we have filtered them out to about 10 to 15. So let's get into it. So our first question is, can rhinoplasty change your face? A rhinoplasty should not be changing how your face looks. It should improve your nose. It should improve the harmony of your face. It will never be you should never get a rhinoplasty done where you're in a position that after the rhinoplasty your face looks different. It should look harmonious. It should look better than what you did. And either ways, I think the question is also intended to, in terms of, say, people recognizing you, there won't be any difference. They'll just see that there has been some improvement in your face. Will it affect your, say, your passport or your Aadhaar card? No, it doesn't, because the change in the nose is not so huge compared to, say, a change that requires you to go change your passport or your Aadhaar card. So I hope this has helped you understand. Rhinoplasty is always done to improve your nose and to improve the harmony of your face, but it is never done to change your face. So all these myths about undergoing plastic surgery and changing the person's face never happens unless you undergo a face transplant. Are liposuction results permanent? So liposuction is a procedure where we remove fat or deposits of fat from certain areas in the body, which means it is not a weight loss regime, it is a body contouring regime, which means if you have fat deposited in certain areas of your body, like say your flanks or your arms or your thighs, areas where you've been trying to work out but you're not able to lose weight, then liposuction is a very good option. Now the question that is often asked is it permanent? In that particular area, when we remove fat from, say, your love handles, the number of fat cells in that particular area decrease in number drastically, and that is the number of fat cells that have been given to you in that particular area. That doesn't mean that the remaining fat cells cannot grow in size, which is why after getting a liposuction done, it is very important that you follow a diet and exercise protocol. But having said that, usually the after liposuction, I haven't seen anyone go to their pre-liposuction body. It rarely happens. So the question of whether liposuction is permanent, yes, to a certain extent it is permanent, but at the same time we make sure that we emphasize the importance of diet and exercise to maintain your results. Our next question is, are breast implants safe? So breast implants, like anything else, like say an iPhone or the camera that I'm talking into, has undergone multiple changes in its iteration. An iPhone has started from an iPhone 1 to a 16. The camera that I'm talking to also has had multiple versions to come to this position. The same way a breast implant is now in its 6th generation of implants, which means over the last 30 years they have improved the quality, improved the kind of silicone that is used. They have improved the cohesiveness of the implant. They are able to give a certain amount of projection to the implant. So these are the things that have been researched over the last 30 years, and we have come to a position where the possibility of capsular contracture secondary to an implant, which used to happen say 15 years ago, has reduced significantly because of certain studies in terms of implant preparation, implant pocket preparation, the implant irrigation, all these things along with the quality of the implant. So it's very important that you choose the right company of implant. And so in terms of the quality of the breast implants, like I said, we are in the 7th generation. There are two things. One is to what number of years can you have the implant before you need an implant exchange. Usually what happens is the implants which are present right now are easily, they last for about 20 to 25 years. Now having said that, what does that mean? So now suppose you get a breast implant done say at 25, breast augmentation done at 25-30. So we add 25 years to it, which means say you're now 55 to 60, and then you think about your breast implant. What does that mean? It means the implant can still continue functioning for as long as you live, but the companies at present give a 20 to 25 year range of longevity of the implants. Also at 60, it depends, you might need another procedure because there might be a lot of sagging of the breast. Depending on your requirement, you might choose to have a breast lift and the same implant can be used, or you can exchange the implant for another implant. So what we have noticed is that implants now have come to a position where they're extremely safe for the present, for the future. They have longevity, they do not give any long-term problems. The procedure itself is very simple as long as you plan well before the procedure, which means you choose the implant well, you place it in the correct place, and take care of the implant in terms of regular follow-ups with your doctor. This is another question that is so commonly asked. Can gynecomastia go away with exercise? And this is a question that I think I have answered many times. Gynecomastia, as you know, is a combination of fat and gland, which is a breast tissue which develops during puberty because of activation of estrogen. So now, having said that, a lot of them try to fix the gynecomastia just by exercising. What does exercise do? Exercise works purely on fat, which means it can reduce the amount of fat in your chest, but it can never take away breast tissue. This is the same concept as if you would ask a woman who has had a larger breast and then over a period of time loses weight. What happens to her breast? The fat in the breast reduces, but the breast tissue, which is the gland which produces milk in women, that does not reduce in size. So the same thing with men. If you go to the gym, work out, diet, what happens? The fat might reduce and go away, but the gland never goes away. So even in bodybuilders, as you know, a lot of bodybuilders who take anabolic steroids, as an offshoot, develop gynecomastia and a puffy nipple behind their nipple, because of which they come to us to remove that gland. So you imagine this, a man who is probably in that less than 10 fat percentage group still has a puffy nipple and a gynecomastia. Why? Because even though he does not have fat, he still has a lot of gland, and that gland only can be removed surgically by a procedure. There is nothing else that can be done to remove the gland. So gynecomastia is a very common condition in Indian men, probably because of genetics, because of the kind of food we eat, or the quality of the food that we eat during puberty, because of which we might have as you call a gynecomastia or a man boobs in our body. So like I said, it does not go away with exercise. You will need a procedure for gynecomastia because of the gland. Thank you. Will tummy tuck help me lose weight? So tummy tuck, as you know, is usually done in massive weight loss patients or in mothers as part of a mommy makeover. So when we do a tummy tuck, what we usually do is a combination of 360 liposuction of the abdomen, flanks and back. Along with that, we take out the skin which is up to the navel or the umbilicus and pull that skin down towards the C-section scar. So what happens during that time? One, during the liposuction, we take out, depending on how much you have, a certain amount of fat out. That helps you lose a certain amount of weight. Along with that, usually that entire paddle of skin that we take out usually weighs between about 500 to 1.5 kgs. So that paddle of skin which is taken out as well contributes to your weight loss. So if the question is, will tummy tuck help me lose weight? Yes, it does help you lose weight in a particular area. Usually we see weight loss between about 1.5 to 4 kgs. So yes, it does help lose weight, but at the same time it has to be understood that tummy tuck is a body shaping or a body contouring surgery, and weight loss is a byproduct of this procedure. Thank you.